presentation, Dr. Zainab Nahid, and it will be followed by the last paper of the session, Dr. Anusuya. Ma'am, please start.
Good afternoon, respected judges and delegates. I am Dr. Zainab Nahid, and I'm going to present my study on variations in the central corneal thickness during the menstrual cycle in Indian women. The study was done under guidance of Professor Deepak Mishra sir. I have no financial disclosure. Introduction. The menstrual cycle in women has fluctuating hormone levels. LH receptors are found in ocular tissues such as the cornea, iris, ciliary body, lens, conjunctiva, lacrimal and meibomian glands. These hormones can increase the central corneal thickness by water retention in the corneal stroma. It can also increase the intraocular pressure during the menstrual phase, and it can also influence the tear film production and stability. So the aim of this study was to determine the variations in central corneal thickness during menstrual cycle in Indian women. Materials and methods. This study was prospective observational clinical study done in RIO and Obstetrics and Gynecology Department of IMS BHU. Number of subjects were 126, which were followed up for 3 years, and it was ethically approved. The inclusion criteria was women between 18 and 45 years of age with normal menstrual cycle. And exclusion criteria, we had previous history of eye surgeries, conditions affecting the central corneal thickness like keratoconus, scarred corneas or dry eye, history of infertility, polycystic ovarian disease, pelvic inflammatory disease, contraceptive use, breastfeeding and diabetes mellitus. We screened 735 females, out of which 163 females fulfilled the above criteria, but 37 females refused to participate, so study was done on 126 females. Self-reported dates of the menstrual cycle by the participants were noted. Ovulation time was confirmed by the urine LH level, luteinizing hormone levels of 25-30 international unit per liter was taken to confirm the ovulation within 24 hours. A complete ocular examination was done to rule out any ocular abnormality. CCT was measured by an ultrasound pachymeter, Tome SP 300 pachymeter, within consecutive 3 days in all 3 phases. Data were analyzed by SPSS version 20. So now on the results, we got the mean age of participants was 26.6 plus minus 2.6 years. The mean duration of cycle was 27.9 plus minus 2.9 days. In 92% of women, CCT changes were seen, while in 8% there was no difference between any phases of the cycle. So what we got, the mean central corneal thickness of both eyes were 541.76 plus minus 4.21 micrometer at the start, 559.21 plus minus 4.50 micron in the middle, 544.52 plus minus 8.06 micrometer in the end of the cycle. So we compared the mean central corneal thickness of the right and left eye in micrometer during the different phases and the entire menstrual cycle, and we applied t-test, unpaired t-test in the beginning, middle, end, and entire cycle, and what we got that it was not statistically significant. But when we compared the mean central corneal thickness of the right and left eye during the different phases in the left, right, and overall, like between the beginning and middle and end and the beginning, what we got that the values were statistically significant. So in discussion, I would like to say, and there was a study by the Feldman et al. And Sony, and they stated that lowest central corneal thickness just before ovulation and maximum at the beginning of the cycle. Kiley et al., the cornea was thickest at the time of ovulation, and study done by Faruqi et al. Concluded that the cornea was thickest during ovulation time and the thinnest at the end of the cycle. In our study, the cornea was thickest at mid-cycle, followed by the end and beginning of the cycle. So we concluded that CCT value was significantly higher during ovulation compared to the beginning and end of the menstrual cycle. So our study recommends that menstrual history may be included in the workup of females undergoing refractive surgery, intraocular pressure measurement, contact lens fitting trial. There are some limitations of the study also. The stages of the menstrual cycle and follicular maturation were not verified by abdominal ultrasound. Luteinizing hormone levels during all phases of the menstrual cycle were not measured, so correlation between central corneal thickness and luteinizing hormone levels was not possible. We could not explain which layer of cornea is responsible for changes in CCT as we used ultrasound pachymetry. These are my references. Thank you.
uh, what do you think will be the real utility of, sorry, real utility of this kind of a study which you have done? Because you'll take the menstrual history during the, as you said, during the workup for various refractive procedure. Will it make much difference? Because it is such a minimal difference in thickening. Will it make a difference? Is it significant?
Actually, we never asked the menstrual history of when we do refractive surgery on the patients. And also in glaucoma, the menstruation is a monthly phenomenon. So how would you benefit from such a study in the sense in terms of glaucoma or even in terms of refractive surgery? How would you really benefit from this study? Because what would be the usefulness of a study like this?
So actually, in most of the post-operative refractive surgery, sometimes we get refractive surprises in patients. So this study, because in our study we concluded that during ovulation there is significant changes in the central corneal thickness. So it can, and this study was never done in an Indian population. In UK it was done and it was published in PubMed, but there is no study which was published in on PubMed in Indian population. So we did this study so to avoid any post-operative refractive surprise in females. Just like in glaucoma also, like there is change in central corneal thickness because in change in IOP. So because it is hypothesized that during ovulation period, there is a secretion of the antidiuretic hormone, surge in secretion of antidiuretic hormone, which increases the intraocular pressure, and in response to it, there is increase in central corneal thickness.
Zainab, the question is that 18 micron difference we have shown between beginning, mid, and mid mein sabse zyada hai. That is around 559. 18 micron. And is it significant enough? Because we know that all these menstrual hormones cause water retention.
Yes.
Cause water retention, and thickness is bound to have. I do not know whether it's a visual impact or not. Because even with glasses, suppose somebody is wearing glasses, तो blurring of vision तो उससे भी होगा ना, अगर होना तो. Only thing thickness 18 micron for few days it will be there. Is that right? 18 micron. This is what I have understood.
What would be the clinical
So
utility?
this is just a research topic which is going on, so we can more conclude if we will do it on multi-centric level and with more sample size. But we can include the menstrual history and we can avoid the post-refractive surprise, sir. Post-refractive cataract surgery surprises in patients.
When do you suggest that the refractive surgery should be done in this menstrual cycle?
Pre or post, no, not during mid. Pre-post करो, mid में नहीं करना.
Mid, yes.
यही है ना?
Yes.
Mid में नहीं करना.
Yes.
ठीक.
Okay. Thank you, Dr. Zainab, for the